Vitamin D has a very wide range of roles in the body. These roles are as diverse as calcium and phosphorus regulation, effects on skeletal and cardiac muscle, and brain function. In terms of outward signs, your patient may look completely normal, which is a most likely scenario. However, they may describe signs and symptoms such as chronic lower back pain and fatigue. Further discussion may lead you to question them around sun exposure. Do they use sunscreen all the time? Do they get regular exposure to the sun? As far as dietary influences are concerned, it would be worth checking if they eat sufficient oily fish or eggs. Have they had a diagnosis of osteoporosis, or are they at risk? Again, this is a very important question. Factors that might increase a risk of deficiency are many, as deficiency of this nutrient is fairly widespread. The risks are mainly around reduced sun exposure, so think of the elderly, hospitalised or housebound patients. Also those that cover themselves for religious or cultural reasons or to avoid tanning. A naturally darker skin tone means a need for increased periods of sun exposure. In addition, overweight and obese patients are associated with lower levels of vitamin D. Medications that may increase risk of deficiency include orlistat, which decreases vitamin D absorption, whilst caution with thiazide diuretics is also recommended, as vitamin D may increase the risk of hypercalcemia. So to summarise, the typical patient who might be at risk of vitamin D deficiency might be elderly and housebound, or conversely anyone in winter or who lives in a colder climate.